The fate of some 200 mental health inmates who have been abandoned by their families at the ACCRA Psychiatric Hospital hangs in the balance as management prepares for what it terms a major facelift of the facility. Here's a report by Sarah Apenkro.
In the next 7 months, these structures serving as the ACCRA Psychiatric Hospital are expected to be pulled down for construction work to begin for the facilities redevelopment project under the Agenda 111.
In the meantime, the redevelopment has significant implications not only for workers but inmates as well. There are 320 inmates currently at the facility, out of which 120 of them are patients on admission, while the remaining 200 have been treated and discharged but have been abandoned by their families.
We feed them, we clothe them. When they are ill, they have to go out to the for clinics and so on. We pay for them. Most of the time, relatives leave their patients with us for a long period. Even when they are well and we call them to come for their patients or their relatives, they don't come for them. So then it beholds on the facility, in order to prevent overcrowding, we send the patient back home. Therefore, we thought there was a need for a composite plan to permanently locate these patients without overburdening our sister facilities.
But there are concerns of a possible mental health crisis as the hospital struggles to repatriate them. About 300 staff of the hospital will also be affected due to an ongoing downsizing of the facility.
Currently, APH has a workforce of about 800 staff. But with the cutting down of the services, then came the need for us to trim down the number of staff that we would need, because again, we want to prevent any redundancy in the facility. Management is still deciding. Okay, we've chosen the services. We're still looking at the human resource needs, but averagely we think that about 300 may go.
Part of the 14.4-acre land size will be fully functional for inpatient care, outpatient care, psychological and occupational therapy, while the other parts, including the staff quarters, will be pulled down for the project to commence.
Management of the facility are hopeful of a successful completion of the project, expected to be completed within a year and a half for special mental health services to commence in full force. Sarah Apenkro, ACCRA Psychiatric Hospital.